Our geographical area in West Parry Sound stretches far and wide.
We have 6,000 square kilometers that we're working with.
Right off the bat, there's too many people in our area that don't have attachment to primary care.
To find a primary care provider is hard. That's the biggest thing.
I want to see patients seen on a timely basis, and at this point in time, it's just not happening.
So they're relying on other avenues for primary care, such as emergency departments and going out of area, or just not having health care at all.
We know that the healthcare system is strained. People are tired. People are exhausted. When we, are asking for more capacity, it's not going to work unless we can figure out how to work together.
The Ontario Health Team was put together to provide attachment and access for all patients in the province, as well as provide timely care.
As part of the work the Ontario Health Team is doing, there's a local primary care network that is currently in its infancy stages here in Parry Sound.
What we're trying to do is efficiently manage funds and provide that attachment and access, while at the same time developing clinical pathways for better chronic care.
To take all of the different siloed aspects of care and try to make them more cohesive.
So CMHA may be able to help with certain barriers that the family health teams or NP clinics are experiencing. We may be able to, hey, we can help you with that.
What you call it is a no wrong door approach. Anywhere that you access the system, that you should be able to be navigated appropriately to where care makes the most sense.
So someone having a primary care provider, either a nurse practitioner or family physician, that they're able to see.
So that their chronic illnesses are well managed and they aren't having to rely on the emergency department for their primary care needs.
Not only sort of wellness in terms of medicine, but thinking about, housing and how can we connect with the social services. It's talking about how do we make sure that patients have the right food to eat, healthy food to eat in their communities. How do we provide a system that isn't just reacting, but is setting up patients and setting up people for success.
Recognizing unattachment is a huge issue, and how do we support attachment? How do we support access? Either in person or virtually, whatever kind of works for them, and that they have access to them as well.
So that patients are caught earlier rather than where I'm seeing them downstream in the emergency department or admitted to hospital.
In the past, we family physicians were thought of managers of all different diseases, but it comes down to now family physicians need to be skilled in complex care and management of chronic conditions such as COPD, CHF.
A community paramedic basically tries to eliminate that unnecessary transfers to the hospital for more low acuity episodic things that should be treated by primary care or could be treated in community, which would free up resources in the emergency department for real emergencies and hopefully assisting primary care so that primary care providers can do what they do best.
What we're looking at is clearing the Healthcare Connect waitlist by spring of 2026. Beyond that, the goal is to have 100% attachment to primary care by 2029.
I need to make sure that the healthcare system is ready and is appropriate for my grandchildren and their children.
We know that Indigenous voices, Indigenous ways of knowing, Indigenous connections through community, Indigenous, approaches to health haven't always been the center. And we carry that truth with us.
And we see that, but we need to live it. And that's what we're trying to do right now. We're really trying to live it and bring it all together and move forward.
To understand what it means to be a good partner in healthcare development. And we understand that those relationships can only move at the speed of trust.
How do we break down all of those barriers so that everybody has equal access to care they need? That's the work we're doing.
And it's quite exciting to be able to be at this table and look at the end goal for our community here in Parry Sound.
This primary care network is our primary care network. And if this primary care network can build a system that is going to truly wrap care around folks, we need you at the table.